It's 3:55. This is Dr. Gong again, and I am going to help you go forward in time. Our next speaker, Dr. Madison Patton, is from Australia, and she is Thursday morning for her, and it's only Wednesday afternoon for us. And I'm saving the best for last. Okay, Dr. Madison Patton is a research fellow at the Cerebral Palsy Alliance Research Institute in Sydney, Australia. She has been investigating the role of stem cell therapies for cerebral palsy and neuroprotection for more than 8 years. In 2018, she completed her PhD in stem cells that target preterm brain inflammation. So we love you, Dr. Patton. Since then, she's been transitioned from the lab into helping drive clinical trials. She is motivated by the demand for research participation and aspires to make safe stem cell therapies available for those who need them. She enjoys science communication and important research conversations. She's less than 3.5 years in postdoc, and she has a strong track record of publications and research with over 400 citations and more than 14 publications in translation research and stem cell therapies. Of note, she recently led a scoping review describing 15 years of clinical stem cell research for cerebral palsy to drive the essential research directions in cell therapies. And when we talked to her yesterday, she was working on a grant. So I hope she gets the grant. And I'd like to welcome you to Texas, Dr. Patton. The floor is yours.
Oh, well, thank you so much for having me. That's such a kind introduction. Let me share my slides. There we go. So it's such a pleasure to be speaking to you all today, and I really wanted to thank the organisers and Dr. Alice Gong for having me here. I hope you find my presentation informative, and looking at your program, I know that this might be an area of interest for a lot of you here, but something that might be completely different, and I hope that this interests you and I can provide some more information. So I'll be following some learning objectives and content for you today. So I'll be starting off by describing stem cell therapies of interest for CP and identifying some emerging evidence. And I really want you to have some greater confidence in addressing commonly asked questions from the public about stem cells, as well as ways to get involved. So I'll firstly by starting off by talking about some progress and some early evidence, but also then covering stem cells 101, how they're working, some areas of interest, and some key clinical trials. I then hope that I can finish off by providing some future directions and some resources for our clinicians here today. Today, I'm talking to you about research that matters to families. So, more than 10 years ago, researchers in our team conducted a Delphi survey revealing the most important research priorities for cerebral palsy and stem cell research. And as you can see, this stem cell research was ranked the third highest research priority by consumers. And since this has really been integral in shaping our research directions, but also shaping the field. And this has led me to working in an incredible team of clinicians, consumers, and scientists. And I get to chat to fantastic audiences like the one I'm chatting to today. So let's start from the very beginning. And you might be wondering, what are stem cells and cell therapies? Well, stem cells are cells which typically have two main properties of interest. They can differentiate and form any cell or tissue in our body. They can also self replicate, meaning that they can go on to make many more copies of themselves. Importantly, they're sourced from many different sources, with some examples here up on the screen. You can see they come from adult sources, maybe even some bone marrow or fats, as well as those classic embryonic or fetally derived stem cells, and those less ethically controversial sources like the placenta, cord blood, and cord tissue. So it's important to remember that when I refer to stem cells, I might be talking about those which come from many different sources or different tissue types. I also might be talking about those which come from autologous or your own tissues, or may actually be sourced from a donor, allogeneic. Keeping in mind this as well, we can derive a variety of cell types from these different sources. These might include mesenchymal, hematopoietic or blood-forming, endothelial, immune or brain cells. So, how are these stem cell treatments working for cerebral palsy? I wanted to preface all of this work that, of course, it's really difficult to cover all of the different evidence from each one of these different stem cells, so I will be talking generally today. So not all of them will function the same, but generally speaking, what we know is that there are many mechanisms underlying a brain injury. These might include inflammation, cell death or loss, some scar formation, changes in blood vessels, and changes in immune function. And stem cells can target some or even all of these mechanisms. For instance, we know that they can change our inflammatory response, they can repair damaged cells or even support replacement. They can also protect the death of vulnerable cell types, plus many more different functions. But ultimately, it's important to remember that different types of stem cells will have different effects or abilities. A very few cells actually can classically regenerate or rebuild the brain, and it's actually more common for cells to be immunomodulatory or provide immunomodulation. When I say immunomodulation, I mean that these cells can sense their environments and produce or secrete factors which change our immune response or inflammation in our bodies. So, where might this immunomodulation fit in? Well, most of you will be familiar with this very important schema of neonatal brain injury, and this was first proposed by Donna Ferrero. So, in the early hours after injury, following an event like preterm birth, hypoxia, or even infection, there's this classic oxidative stress and excitotoxicity and inflammation, and we often see persisting cell death. The inflammation and cell death may extend for days or even weeks. And in the later phases of injury, the brain attempts to initiate repair. It's likely that stem cell treatment may be the best when inflammation is present and permanent injury and cell death is not yet overwhelming the brain. These signals that the brain and body release during these periods may also be helpful for stem cell treatment as the cells use these signals to find areas of injury and secrete and immunomodulate for whatever the environment requires for repair. And more recently, the field has been recognizing that inflammation persists even longer than we first thought. It might not be the same inflammation as it was around the time of injury, but it is still there. And Fleiss and Magales propose that inflammation and epigenetic changes can be persistent for years, not weeks, and that this persistent inflammation prevents endogenous repair and regeneration. And more recently, this has been confirmed in a systematic review about inflammation levels in children with cerebral palsy. So now we're seeing evidence of this persistent inflammation and changes to immune cells, and we're looking much closer at this. And this has been a common theme in the literature. And what we've been seeing is that there are higher levels of these pro inflammatory cytokines. These include the ones listed here up on the screen. And together, these data might suggest that persistent inflammation may be a way that we can target and actually treat these longer periods of damaging processes. And so immunomodulation might be a really important and good way that we can intervene with these stem cells. Now, you might be wondering then, well, just how long does this inflammation persist in cerebral palsy and how long do we have to intervene? And the answer is that we really don't know, but this is an area that fascinates me so, so much. And I wanted to share some more information that I recently read about, which I thought was really interesting and I hope you enjoy. And that's that in a smaller study, what they noticed in those with cerebral palsy is that this inflammation can persist up to 25 years. And one study had shown that there are significant correlations in markers for endocrine hormones, neuropeptides, inflammatory mediators, and all of these are distinct in various subgroups of individuals with cerebral palsy. And when I say subgroups, they were actually found in those babies or those with cerebral palsy who were born very and extremely preterm. So I'm sure a lot of the neonatologists in the room wouldn't be surprised by that. These are the children that they're caring for, and they do see this serious injury around the time of birth. But you can see now that this inflammation is persisting and there might be longer periods to intervene. This study also urges that future research must understand the consequences of these responses in children with cerebral palsy and also consider the potential for mechanism driven intervention. And I really see this as personalised medicine and a way that I can help maybe structure and think about new ways that we can intervene using stem cells. So, considering the potential for mechanism driven interventions, the best solution might be coupling this change in immune function, immune response, or inflammation to target these changes and immunomodulate. And the answer here might be stem cell therapies. You might now also be wondering then, if we want to create this change, well, how are we going to give the stem cells to do this? Well, each cell therapy might be administered in a different way or a different route. Some of the examples are here on screen. So you can give stem cells into the muscle, into the spine, into the brain directly. But importantly, most stem cells don't need to be administered into the brain to treat the brain. And it's really about coupling then their mechanism of action, or how we want them to act in the body, with the way that we want to administer them. So it's not surprising then that the majority of research actually focus on giving them intravenously. Again, hinting at the idea that the cells can be peripheral in our bodies or systemic, and create changes that still help support brain repair. So before I move on from this, I know I've given a lot of information up front. So I wanted just to highlight that I hope this provides a little bit of the backstory of why we would be interested in stem cells for cerebral palsy. This has included that really important and essential consumer and community backing from the beginning, which has helped driven our research directions. I also hope that I've provided some of the evidence to show that this is a scientifically sound treatment. And although there are many different types of stem cells we might be interested in, a lot of them make sense mechanistically, particularly if we give them in the right way at the right dose. I also hope that I've highlighted the complexity of this field, and that there are just so many different ranges of treatment options, whether that be the type and sources, which I hope I can break down a little bit more going forward. And now I would love to touch on this mounting positive safety and efficacy data that we're seeing. So, what is this evidence, and what is the state of the evidence for stem cells for cerebral palsy? Well, more than 5 years ago now, back in 2016, Iona Novak and others in our research team conducted a systematic review of stem cells for cerebral palsy. What they found is that overall, they could analyse results from 5 randomised control trials at the time. And you could see that what they did is tried to understand the effect size of improving motor outcomes. They found that overall, stem cells are safe and could provide a small but significant improvement in motor skills. And this was above and beyond rehabilitation alone, and hinted really at the idea that more research is worthwhile. Of course, though, the safety and efficacy profile of each cell therapy might be different, and looking back on this today, we have just so much more evidence which is mounted to reflect on. So, in a more recent systematic review, we were able to update this, and this was in our a traffic light paper. So, you might all be familiar with this paper. If you're not, I highly recommend you have a read. This review summarises all available interventions for cerebral palsy and their level of evidence to date. So importantly, as I said, this updated review now included stem cells. And if you're not familiar with the ratings in this paper, our group gives interventions a traffic colour code, which you can see on the side here. Green indicates that the treatment is effective and that there is efficacy and safety data, and that you should be doing it. Yellow is uncertain or promising, and red really means that it's ineffective and harmful and you shouldn't be doing it. And what we showed was that stem cells were generally safe in children with cerebral palsy. And when it comes to improving motor function, out of all of the different stem cells which we could rate, there was evidence to grade on these 4 stem cell treatments. Umbilical cord blood was given a green light treatment, and all other cell lines, including mesenchymal, neural, and bone marrow cells, suggested that we needed more research. But again, there was mounting positive evidence in the probably do it direction. And this was a huge and really important finding, and I was so proud to help contribute to this work. But unfortunately, and I'm sure as a lot of you are aware, stem cells are not yet approved outside of research for cerebral palsy, meaning it's not yet available. So then you might be wondering, well, why is this the case and what can we do about it? Our team were asking the same question to ourselves. And obviously, we have lots of families and community members asking the question as well, because they want access to these treatments if it is a green light intervention. So, to answer this why, we first needed to take a little bit of a look back to understand really what the research pipeline looked like, what stages of research we're up to, what kinds of research have already been done, where to next, and ultimately what we can be doing as researchers to help drive this translation of stem cell treatments. As I said, families are demanding this access, so what is our role? And so we wanted to delve a little bit further into this, and I'll now talk about a recent paper that we published last year. So we did a summary of the research landscape. So I thought what I would do first for those of you who aren't all across what the research landscape might look like is to discuss the different phases of research that really drive from initial concept of a treatment all the way through to regulatory approval. So there are many different stages of this. As I said, it might start off with this idea of a case series, trying to motivate more research. We might then go into a phase 1 clinical trial where there's one group to understand if the treatment is safe. We then scale up to a phase 2 where you compare a treatment to a control group to understand if the treatment works. You then, if all of the evidence is positive, you might then scale up. So you might then target a population which mimics more closely what the general population looks like to understand in a much larger group if the results hold true. I also just wanted to quickly touch on that there is an alternate access mechanism to this clinical trial pipeline, and I will circle back to this later. So, this is what we tried to understand for stem cells in cerebral palsy. Well, what does the research pipeline look like for us? So, I'll now present to you our work from this recent paper, which covers 15 years of stem cell research for cerebral palsy in the Journal of Pediatrics and Child Health. I've also popped the little QR code there for you if you're interested in reading about this later. So, what I'm going to show you is quite a complex diagram. There's lots of moving parts, so let me talk you through it. Here is our summary of the landscape. And what you'll see is that along the side here, there are many different types of cell types which have been investigated in research. I've mentioned a few of these before, but one of them is mesenchymal stem cells. There's also umbilical cord blood, autologous, which means it's from your own, or you've sourced it from a donor. And you can see that the majority of research is coming from these top 3 cell types. What you'll also notice is the number of people who have been treated in a clinical trial across the different phases of research and across each one of these stem cell types. And staggeringly, there's been more than 2,400 children treated with stem cells to date, a huge number. And what I also find so interesting about this is looking at these numbers, even for the different cell types, they're huge participant numbers, ones which you would think would contribute to some kind of regulatory approval. And I'm certain that a lot of treatments that we use today didn't even have half the amount of research backing them. So I hope this gives you some context of just how far this area of research has come along. What you'll also notice is that the bulk of evidence is coming from this phase 1 and phase 2 clinical trials. And these total 23 phase 1 and 26 phase 2. So you'll understand then that this is where we've gotten all of our safety data from and also safety and efficacy data. But what is so glaringly obvious in this picture is that we don't yet have phase 3 research. And what we're hearing from our regulators is that more research in this space is worthwhile. And to get stem cell treatments over the line, these phase 3 trials are the missing piece, particularly in the US and in Australia. So, what's next? Overall, I've said there's now 77 cell therapy clinical trials, and there's many, many more planned. And every time I check in on this, the number is growing. So I wanted to now discuss with you some future research directions and then show you how this is being implemented in the field. So of course, we're trying to now focus on much later phase research wherever needed. And of course, there are some stem cell treatments which we still require phase 1 evidence for, but as I suggested, there are others which should be in this phase 3. What we also need is some head-to-head studies of different cell types to determine the best cell. As you can imagine, we're all running along the research pipeline trying to uncover which cell is best, but very little research has been done to understand the efficacy in a head-to-head situation to really rule one treatment out from the other. And of course, what we're also seeing is this stricter inclusion or more focused recruitment, which is helping us to answer, for given populations when we should be intervening, and how we should be intervening, and what types of people we should be recruiting for clinical trials. I'm sure our audience can understand that cerebral palsy looks really different in each individual. And so we're seeing this idea being incorporated into a lot of the studies designs now. What we're also seeing, which is very promising, is the use of donor products over the use of your own banked cells. And this is helping us overcome issues with standardization and sourcing, and also helps enable repeat dosing. A great example to wrap your head around this concept is the use of umbilical cord blood. If you're not collecting umbilical cord blood at birth for your own child or for yourself, then you have no access to using cord blood later from your own samples, and it means you will need to seek a donor. It's completely understandable that this isn't a feasible option for many people, and many people wouldn't even know that they need their own cord blood. So it's wonderful now that we're seeing the field being transformed into not needing these, your own cord blood or your own stem cells, and instead really maximizing the use of finding donors and samples that come from banks and ones like those. What we're also seeing is that a lot of research is investigating treatments which treat much earlier and closer to the timing of injury, really hinting there at prevention rather than treatments or cures. And this also helps in enhancing efficacy. What we're seeing is a lot more preclinical and clinical data to suggest that earlier might be better, and we're therefore able to hopefully maximize impact of stem cell treatments. And I will circle back to this one a little later. So now I wanted to cover what research is happening to progress this field and touching on those what's next. So of course, research is our way to ensure that patients get access to treatments. And going forward, I would love to talk you through some main trials and teams of interest and some recent publications and emerging data. I'll talk about some future directions. And moving forward, I wanted to focus then on two main cell types or cell treatments, which have been studied the most so far. These are mesenchymal stem cells or MSCs, as well as umbilical cord blood or UCB. So first up, I wanted to focus on MIN 2020. This was a phase 2 randomized control trial that recruited 92 children with cerebral palsy. It was a 4-arm study with the first group having one treatment of donor cord blood. And this was compared to 5 doses of erythropoietin. And this was then compared to a group which received that dual treatment of cord blood or EPO and compared back to a placebo group. What they found is that both EPO and cord blood improved gross motor function, and that together in combination, the treatment had synergistic effects. This suggests that combination therapies have the potential to be more effective and add strength to this green light that we gave for umbilical cord blood. And we certainly see now that this is an area of interest, and there's growing evidence now in the space of trying to combine therapies together to enhance efficacy of stem cell treatment. The next study that I wanted to focus on was GU 2020. This is another phase 2 RCT, which recruited 40 children with cerebral palsy. And this study compared 4 doses of these mesenchymal stem cells given at different intervals against a placebo. The main finding was that MSC treatment was safe and it improved activities of daily living, comprehensive functional assessment, as well as the GMFM for gross motor function. You'll remember as well that these MSCs had a yellow light. So these types of phase 2 clinical trials are really helpful information that helps support the efficacy of MSCs. I wouldn't be very surprised if soon this amber light gets changed into a green light. And so now we've just seen these 2 studies that both show positive effects on gross motor function from either the treatment of cord blood and MSCs. But as I said earlier, what the field really needs are head-to-head studies where we can start to understand if and what kinds of particular stem cells might be effective for a given population. So this important study by Duke University called Accent CP directly compared donor cord blood with 3 doses of these mesenchymal stem cells, which were collected from donor cord tissue. The results were presented recently in a poster at a conference, and while we're awaiting full study results, I thought I would share this with you now. Their main findings were that umbilical cord blood was safe and did improve gross motor function. And really, quite interestingly, in this population, MSCs were also safe but did not improve gross motor function. And so this starts to paint a picture that different cell types might be more or less effective. And this really is so interesting and means that we should be doing more research of this kind to rule out different treatment options. Along a similar line is ACT for CP. This is another important head to head study which compared your own cord blood to using bone marrow stem cells. And this study acknowledges that not all children will have access, as I said, to their own banked cord blood, and bone marrow might offer a nice alternative if we needed to source a patient's own cells. However, there is research to show now that bone marrow cells might not be as potent as cells from umbilical cord blood. So, this was a really important study. And I'm really keen to see the results from this. However, we're still awaiting publication of the results. But what I'm thinking in this space is that it is possible that the study might show that bone marrow cells are indeed as effective as cord blood, or alternatively, it might provide additional evidence to support the use of donor cord blood for those who don't have their own banked. And this will ensure effective treatments can be available for all. So, a really important piece of the puzzle that I can't wait to read about. So, in terms of what trials are coming up, I know this is a really busy slide, so I'm not going to go into any of these trials in too much detail. But I thought this provides a great overview for some resources and trials of interest and also those in progress. And it'll be a really good space to watch for the outcomes of these trials in the next few years. I think it's really interesting to note that trials listed here actually amount to over 380 participants. It might seem like a lot, however, there's a huge variety of cell types being tested, as well as heterogeneity in the participants in terms of age that you can see here, or even type of cerebral palsy. So, really, more research is needed. And you can imagine then that across all the different types of stem cells and ways we can intervene, all the different types of research are therefore warranted and make sense. It's also important to acknowledge that we know many trials do have this unknown status. This is really just a snapshot in time, and things might change, say, if I check it tomorrow on clinicaltrials.gov. And as an example, there are currently 10 stem cell trials for CP of unknown status. In addition, unfortunately, many of these trials might be completed. There might be a delay then in getting published, or they might just not publish at all, which is a huge issue across the board. But nevertheless, we hope to see more high quality evidence being published in this space, and particularly, we'd love to see phase 3 trials, as I suggested earlier. So, another area of interest that we are working on at the moment is that idea of treating earlier to maybe have some better outcomes. So, I wanted to just really briefly touch on this and some areas of interest. What we are seeing in the field when we look at these registered trials is that there are many popping up treating very preterm babies, term babies with stroke, babies with earlier diagnosis of CP, even around the 3 months age bracket. We're also seeing other indications being targeted, like HIE or an infection, chronic lung injury, and babies that have undergone heart procedures after a heart condition. Whilst this is a huge area of interest, it's still relatively new, and we're only seeing about 10 studies currently recruiting into this field. But I did want to touch on this just really high level because I know my audience and there's lots of neonatologists here. So I thought I would discuss very briefly some of these stem cells for causal pathways and the trends going on in these clinical trials. So, our major players and major areas conducting this research include the US, China, Japan, and South Korea. Again, we're seeing these major cell therapies being investigated, like umbilical cord blood and mesenchymal stem cells, mostly from cord tissue or cord blood, which is quite similar to what we are seeing for treatments for cerebral palsy. But interestingly, as I said, it is still early days for this field. All of the research to date is being done in phase 1 or 2, and it's in the safety, feasibility, or even early efficacy space. And very few, less than 10, are actually completed and published at the moment. And it's an area I'm really keeping a close eye on. So I understand that the audience are mostly neonatologists. You might have a really strong interest in this area, and I would be more than happy to provide some more information on these trials if it's something that interests you. I often keep a summary and an up to date snapshot of what's going on in the field, and I'd be happy to pass that on. So, switching gears a little bit now, I'm here today to share some information, but also help the audience directly upskill in a complex scientific area. I want you to be able to have some greater confidence about the information that I've spoken to you about today. And I can completely understand how difficult that is to do in one presentation in just one sitting. But I wanted to share with you that this can be done in just a few hours. And it comes down to making sure that clinicians, like the ones in the room, can have some more open conversations about stem cells and cell therapies with their patients and consumers. And at the Australian Academy for Cerebral Palsy conference 2 years ago, I ran an interactive workshop that asked clinicians and anyone present, including community members, about their experiences and the types of stem cell questions that they're getting from their patients or the ones that they're asking. And what we found is that the majority of clinicians are being asked by their patients about stem cells. You can read a little bit more about this paper by scanning the QR code here. But what was so fascinating is that whilst the majority of clinicians are being asked by stem cells, before the workshop, most indicated that they weren't confident discussing stem cells with their patients. And I'm really not surprised by this. As I said, it's so complicated. Their questions themselves are so intricate and complex, and there's lots of nuance and understanding of the field to help approach and give compassionate responses. But most commonly, what we see is that these clinicians are asked about accessing stem cell treatments, where the evidence is up to, and where this research is headed, and the state of the current evidence. And what we found is that after a 90-minute interactive workshop where we were able to break down the FAQs, the Stem Cells 101, also have a panel of people where we could discuss all of these topics, what we saw is that confidence in discussing these areas with patients was significantly increased. And what this shows is that I think we need more of this, that consumers need better support in decision making and clinicians need support building confidence or knowing who to ask. So, before I continue on, I would love to now hear your thoughts. I'm assuming that everyone here might be in the same boat, but I'm really not sure. So, in the chat, I'd love to know if you do get asked questions about stem cells. Perhaps you want to use that little icon to raise your hand if you get these questions a lot or if you get asked about them a lot. Otherwise, in the chat, if you're a clinician, I'd love to hear what types of questions you get asked. Or if you're a community member or someone else who are interested, please pop in the chat a question that you have about stem cells. I'd love to understand kind of where everyone's sitting today and if you have similar experiences. So please go ahead. Yeah, great. So I'm seeing some questions about cord blood, clinical studies, and how we can provide access to our patients. Great questions coming in about compassionate access, and I really look forward to touching on this soon. The Duke trials. Yeah, I can see some private clinics and people traveling. So these are mostly questions here around access, which I'm not surprised about. So let me continue on. So, as I can see here popping up in the chat, and as I'm happy for these to continue to roll in, they're really touching on these common questions which I get quite a bit as well. So, they're either stem cells 101, how are they working? How can we use them? But also this patient access to stem cells, whether that be via traditional research, compassionate access, expanded access, or even private clinics. And then also that current evidence. So, should I be storing cord blood? What can I do about it? Those sorts of things. So hopefully I can give you some really great examples and resources now moving forward. So, first of all, how to tackle those stem cells 101 questions. Well, I think you're in a really brilliant place here. I do suggest that the first place you go is conferences, and we're seeing more and more of these stem cell sessions popping up, and they're incredibly helpful. You get to hear from larger teams, you get the bigger picture of the landscape, which I think is so important to be able to communicate effectively. I hope also that you can reach out to some expert contacts, and I'm more than happy if you would like to send any questions my way. We get asked questions all the time, and I have lots of clinicians who are recommending or handing over some questions when they don't feel like they're best placed to answer that. So please use your networks wherever you can. And of course, there are some wonderful resources that I'd like to point you to. Some really good ones that I recommend are using the Euro stem cell resources for just kind of a breakdown of quick facts of stem cells, as well as this International Society for Stem Cell Research handbook, and their website is phenomenal. So, highly, highly recommend. I often have a little folder, and all of these PDFs are saved, and they're ready to go for anyone who asks me some questions. However, I also recognize that there isn't too much cerebral palsy specific info. You might be handing off or reading a lot of information, but it's really not specific to the population or the clinical trials that people might be interested in. So I've also been working alongside my colleague, Dr. Megan Finch Edmondson, to help develop some online resources. So I've also popped the QR codes for them up here. It's hopefully going to be expanding because I am really interested in this area, but we have developed some online resources in some FAQ videos and some articles. So really starting from the very base. So now about that patient access, which I can hear from the audience is probably where most of the questions are coming from. Um, as you can understand, and as I've touched on before, the reason why we get probably so many questions about access is that there is the disparity between such mounting positive safety and efficacy data coming out, but then the lack of availability for people to actually get in these clinical trials. And the fact that stem cells are not currently approved for any indication, including cerebral palsy. So they're only so far approved for blood conditions and blood cancers. So in the first instance, what I would recommend is always refer back to clinicaltrials.gov. This helps understand currently recruiting trials or other region-specific trial registries that you might be interested in. So say you have a patient who might be in China, you might be wanting to look on the Chinese registry instead. And now I'd love to touch on those alternate options which were hinted at in the chat as well. So to change tack slightly, and for those of you might be really familiar with this space or you might not, so please bear with me. But as I've shown you before, you might be now quite familiar with this diagram that I showed you that we published. But I did just focus on these clinical trials. So now I wanted to draw your attention to this last column called expanded access, which might also be referred to as compassionate use or compassionate access. Expanded access programs can be considered to be an alternative mechanism to gain access to unapproved therapies. And whilst there is some regulatory oversight, we really consider these to be quite separate to clinical trials. So, in terms of cell therapies for cerebral palsy, there's expanded access programs both in the USA via Duke. This has been active since 2017. Got some information there on the screen there, and you might want to go look this up a little bit later. But there is also more recently an expanded access program called FamiCord, which is operating in Europe at the moment since 2019. And these have been really brilliant in enabling access to stem cell treatments before they have been approved for use in cerebral palsy. And particularly, it's enabled use of of using cord blood from your own stored, but also using mesenchymal stem cells from a donor as well for children with cerebral palsy. And what's so interesting though is that from our publication, we can definitively say that 285 people have been treated using these expanded access programs, and this is the published number. However, this is likely to be a significant underestimation, and from what we know, this number is possibly in the thousands. It's important to remember as well that whilst these programs do charge fees for participants, they also don't have this extensive follow-up. However, they are an attractive access mechanism for families seeking stem cell treatments, and they do provide some regulatory oversight. They follow the same protocols as the clinical trials, and they might be seen as an option for families. But now I wanted to discuss something which is often asked about as well, alongside these clinical trials and expanded access, and I can see those comments coming in the chat box, and that's that the private clinics and stem cell tourism. And so to break this down again, if this is a new idea to you, I wanted to start off with the idea of why these private clinics offer treatment and exist. And as I've said before, it really comes down to supply and demand. Once again, there are no approved stem cell treatments for cerebral palsy. And as you can imagine, a lot of people aren't even eligible for these expanded access. Perhaps they don't have their own umbilical cord blood, perhaps they don't have the money, perhaps they can't travel to another country. And also, again, there's just such that small inclusion criteria for those programs. There might be so many reasons that it doesn't work for them. And so what we are seeing is that people do travel overseas, whether that's expanded access or for private clinics if they don't meet this eligibility. And so I wanted to really discuss then why private clinics function so differently than research or expanded access. And this is really important to keep in mind as we try and support our consumers. So, private clinics are likely a company or a for profit organisation. There are fees associated with the treatment, and legitimate clinical trials, as I said, and research will not charge. Results from these works are not commonly reported or published. It also means that they're unregulated and non standardized, and sometimes there is that limited regulatory oversight. So, a lot of people pay a large amount of money and they're not really sure what they received. I think what's so important out of all of the differences is actually to acknowledge that we don't really know the outcomes of these patients, and particularly those with cerebral palsy. We hear of a handful of families coming out with, good or maybe some bad experiences, but ultimately it doesn't help us understand if these stem cells treatments are working, and it doesn't help us advance through that research pipeline. And so, whilst there are legitimate options that are slowly becoming available for really now, private clinics are this grey area. And so, I really want to highlight as well that decision making for families and clinicians in this space is really difficult. And of course, each clinic is different and there is this spectrum of risk. So we need to be doing a lot better to support and protect our patients and consumers, and particularly in this safe decision making. And I do believe this begins with more open discussion about this and about decision making. And really, clinicians have a big role to play. So, where to begin and how can I help with this? It's so complicated, isn't it? So, I just want to let you know that there are resources out there, and of course, you can always put them in contact with me, as I suggested. But in addition to that, there are some really great online resources. For example, there is a closer look at stem cells, which I highly recommend. Um, what happened is this group developed a patient handbook, which is now published in multiple languages. And this is often the first thing that I will hand over to someone who's interested in stem cells. In Australia, we also rely heavily on Stem Cells Australia. They have a brand new handbook resource and they've also relaunched their new website. They also have this amazing checklist, which is so useful, even for myself, but it is aimed at consumers. And what it does is it enables everyone to be able to critically appraise private clinics or anyone really offering stem cell treatment, including a clinical trial. It makes them have as the name suggests, a closer look at what they might be buying into or participating in. So that's me all wrapped up, and I hope I've been able to cover some of these key learning objectives and some of the content. And I hope that you've been able to walk away, maybe being able to describe or articulate where the evidence is up to, what types of stem cells we are interested in, but also have a little bit greater confidence in addressing some of these commonly asked questions. So I've popped my contact here on screen. Please get in contact if you have any questions, and I'd love to chat some more about this as well. So thank you so much for your time today, and it's been an honour being able to present to this group.
Wow, thank you. Thank you very much for all that information. It's good to know where the research is going with stem cells, because I think that's where we need to be to kind of learn more. I don't see that many questions in the chat, so I was going to ask you. I know at one time we in South Texas had had our blood bank that was doing a pilot cord blood bank. I don't know what's happened to it. For us, SCID is one of those things that we now do in newborn screening, so that was going to be the source of the transplants for those kids. But that's not as big a number as, say, stem cell, for CP. So are there any viable public banks for cord blood?
Yes, so it's tricky to understand at any given time what it looks like in the United States. As far as I'm aware, there are a lot more private banks that are now functioning. However, I am aware of a number of different public banks that do, as you said, collect cord blood for those hematological conditions, and that is an option for families. And as far as I'm aware, um, what's so interesting is, as you said, you've got such a niche condition which requires cord blood. It also requires perfect donor matching often at times, which means that they have had to go after a massive pool of donors. So they're sitting sometimes on 60,000 samples. So we're talking tens of thousands of samples. They might only actually access for these blood conditions a handful of times per year. So that also opens up that idea for us in other conditions and indications of being able to tap into this wonderful resource that you said, whether it be private or these public banks. And that's certainly the way that we're seeing our research headed as well. And in Australia, for instance, we're now partnering with our own public cord blood banks to see how we can use these samples, which wouldn't ever be used in other conditions for, say, cerebral palsy.
So, not that long ago, there were articles written about the private banks and their lack of, I guess, reliability, that you may pay to have your cord blood of your child sent off to save, but are they actually doing it? Are they keeping it? Are they storing it? And those kinds of things. So if you were interested in this, what would you look for in a private bank that can assure you that, say, 5 years down the line, you need that sample, that you could get it?
Yeah. So what families are really looking for is factor accreditation. So you're looking at reporting standards and collection standards which meet, a benchmark and are the gold standard. But can I just say as well that cord blood banking and any banking of any tissues it's a personal choice. It comes with a fee, and a lot of people aren't in a circumstance where they can, pay this and secure banking of any tissues. So I'm certainly working in the space too where we can broaden the way that we look at these treatments, that we won't have to rely on everyone banking their own samples, because I think that really puts people in such a bind, doesn't it? Because imagine if you are that rare family who hasn't banked their cord blood sample and then goes on to have a diagnosis of CP. It's just not fair that these people can't access something which might be effective or safe if they don't have any other treatment options. So certainly, whilst banking is an option and it's a personal choice, we are trying to move away from the reliance on autologous or your own samples and starting to look at how we can use donor samples more effectively. And just on that as well, I can share with you that 15 years of research paper, but a great indication for the field is that most of the research now is being done in these donor samples. So I hope too that reassures that people that someday, even if they don't have their own cord blood, they can't get into these expanded access programs, the research is headed in more of those donor sample treatments.
Like, can I ask, like, how much improvement do I know it seems like there are a lot of patients but how much can you expect? So say for a child who's got very severe CP, is there hope that they can walk?
Yeah, so look, that's a really difficult question. And it probably comes down to that idea as well that there isn't much research being done saying just targeting the most severe level of those with cerebral palsy. But what we're seeing is the greatest improvement is coming from those GMFCS levels 2 to 3, so the moderate rather than the most severe. And as you probably suggested, it probably comes at the idea that we can hint better at improvements in their motor outcome, and we're not looking then for people to be immobile to then being able to walk, whereas we're looking at those smaller motor improvements. And so that's what more of the research is hinting at. We're not looking at cures. And of course, I think that's actually probably one of the biggest red flags if you're hearing from someone that says that these are miracle treatments or anything. We're looking at something which can significantly improve motor function, but that will look really different for each person. And as I said, most of the data is hinting at that it is those moderate severity um, cerebral palsy levels. But adding to that, though, there's a lot more work to be done to actually optimize treatments. And so I hope I've been able to show you as well that a lot of the new research are trying to target those earlier ages, those moderate severities. And I hope to see that those results of the studies will actually show far greater efficacy. On that as well, we have so much data coming out, but no one really has been able to synthesize this information and give that answer to that question that you said. If I have someone who has GMFCS level 5, can cord blood say help? And so we're actually working in this space on a massive data analysis to understand if we can tease out a lot of those answers as well. But I hope I haven't been too vague, but really there isn't a straightforward answer.
Well, I'm going to ask you another question that may not
Yeah.
have a straightforward answer, and that is, are there any long-term follow-ups to show that you have sustained improvement, or is this a temporary
Yeah.
thing?
Yeah, so what we've seen from research is that the longest follow up has only been about 2 years after treatment. What we see is that the efficacy is mostly gained, like it's peaked efficacy by around 6 months, as far as we can tell. It is sustained until the end of the trial. However, beyond this period, we're not sure. So we have been looking at a lot of clinical trials which are now registering long term follow up. I'd be really interested to see this. But a lot of the narratives in the field are actually now understanding that you will probably require a repeat dose, or at least repeated doses after, say, a number of months to see a sustained effect. But again, I don't have the answer whether that is necessary or ideal, but certainly we're seeing a lot more research now trying to understand that, and a lot more research designs extending the follow up, particularly when they're trying to measure efficacy, and to understand then if a repeat dose is required if we see that efficacy being lost.
So you said you were writing a big grant. Are you writing a grant to do a clinical trial?
I am. Look, it's early days, but it hints at those causal pathways and how we can be treating much earlier. What you would have seen is from that Duke trial where they went head to head trying to understand the efficacy of cord blood versus MSCs, cord blood came out on top. And what they found as well is that that doesn't mean that these mesenchymal stem cells should be ruled out, but it might mean that earlier treatment with these really strong anti-inflammatory cells like these MSCs might be better. So we're trying to design now these next phases of much earlier, like treating much earlier, to understand if we can use these cells in the first few days of life and be able to improve on efficacy.
How long can you recover the stem cells from cord blood? So is it feasible to say that if you gave birth in a hospital and you gave birth to an extremely immature baby or a baby with HIE, that they can go and recover enough that you can raise stem cells from? So I know that recovery of the amount of blood is a very difficult thing. Like I know trying to collect 70 cc's one time for it was a very difficult thing. But say if you can collect 30 cc's because that placenta and that cord has been sitting there for say 24 hours, would you be able to grow stem cells from that? Is that something
Yeah.
that the research arena has improved upon?
Yes. So, as you can imagine, there are standard protocols, particularly for a clinical trial, on how to get the most amount of cells and the most living cells, which would make an optimal cell therapy. Let's use umbilical cord blood for an example, because there are so many different stem cells in the placenta, so the cord tissue and whatever else. But let's use umbilical cord blood. You can imagine that if we're not collecting immediately from the cord, it will clot
Mm-hmm.
and you will not get a sample. So from what I'm seeing and from my experiences, because I've also collected cord blood from over 300 deliveries, and I feel your pain. um, so what generally happens is that cord blood should be collected immediately, and it's the time till processing which is the most important. So cells sitting in whole blood, using cord blood as the example, will immediately start to die. And what we really need out of that sample are the white blood cells, and in particular, something called the buffy coat, which will contain all of these important stem cells. The longer we leave that blood or the placenta sitting on a bench, the less viability we have over time. So generally, once cord blood's collected, we need processing to occur within the first couple of days, and this is to make sure we get just the most amount of stem cells possible. As you suggested, though, I think you were hinting at the idea that you've had a complex birth, and that then a baby might come out and be an excellent candidate for these trials. And what happens in those scenarios? Well, firstly, I think that a lot of hospitals are talking to one another now, and there is that option where a lot of researchers might be able to collect the cord blood, just understanding or at least knowing that these trials are going on. But usually, what would happen is that these hospitals do need to be participating in the research for an adequate sample to be collected, just because it is quite technical. So speaking to that, I think it's all about then researchers being aware of the research going on and participating, because you know that if someone was to give birth to a baby with a complex medical condition or a brain injury, then certainly it would be great if these families have access to these research and trials and participation in a lot of these new treatments. So I would highly advocate that each hospital should be talking to these researchers, so that if they do need to collect these types of samples, that they can do that and enable the research.
Okay, I have one last question for you. There is a lot of stem cells in colostrum, and so you would have more time with colostrum than you would cord blood. Has anybody looked at that as a
Yes.
possibility?
Yeah, so the ones that I'm aware of, and so this might not be comprehensive, you can actually grow mesenchymal stem cells, so those MSCs from colostrum. And a lot of the research that I've seen have been about how you can collect those stem cells and grow them up and be able to use them as a treatment from the lab. But the interesting bit is, as again, these mesenchymal stem cells are often, you don't need your own. You can have a bank sitting there, and you can also like grow them indefinitely. And so the hope is that no matter what source you get them from, they can be sitting in the freezer ready to go. So that's
Oh,
an example of a mesenchymal stem cell. I also wanted to point out as well that there haven't been any head-to-head studies of colostrum mesenchymal stem cells with efficacy for cord blood or other sources. But I did hint at that there were research being done to understand the differences between how these MSCs from cord tissue or cord blood or bone marrow might behave. And I think there's a real difference in these. So I wouldn't be surprised actually if these MSCs from colostrum behave quite differently, and might be either good or bad if we're wanting to apply them as a treatment for the brain.
hmm. Interesting. Well, I know we're running out of time, but I have one more question from Dr. Ramamurthy. How long can you get cells from buffy coats? And how much buffy coat do you need?
Yeah, so we can often get a couple 100 million mononuclear cells or billion total nucleated cells from the buffy coat. And we would need to isolate these within a couple of hours after spinning them down. So you'd collect the cord blood, you'd then send it for processing, and it would all be done quite rapidly. But keeping in mind, and I didn't touch on this, but when we do go to treat, it's really not an amount that we need. Like there's no total number that I can tell you would be useful. However, it's actually used based on the patient's body weight. So the number that I would be probably trying to aim for a baby, to treat a baby versus an adult or a child with cerebral palsy, would look quite differently. But there are some studies now coming out to indicate that there are thresholds and dosing thresholds that you should be reaching, and that's a really interesting area of research. So more should be done, and I have a handful of numbers for different cell types, but not for all.
Well, you've been fascinating. So I want to thank you so much. If you're ever in Texas, come look us up. And I promise I'm going to try to get to Australia and see what you're doing.
I would love that. Thank you
Thank,
so much.
thank you very much. And we are going to wrap up. Thank you.